everyone. I'm Bojana Jankovic Weatherly, and today I'm joined by Melissa Reade, our medical practice's integrative health advisor and licensed nutritionist. Today, Melissa and I are talking about all things GLP-1 agonists. We're specifically going to be addressing medications such as Ozempic, Wegovy, Zepbound, and Mounjaro that are used for weight loss and diabetes. We're going to be answering some of the most common questions that we get in our practice and that we've also received on social media. Even though these medications have now been around for a very long time, in fact, GLP-1 agonists have been around for 20 years, and some of these newer ones have been around for several years, we're still getting a lot of questions from patients and through social media with respect to how to best manage these medications and also how to mitigate some of the side effects. For instance, one of the questions we get a lot is how do we reduce the risk of loss of muscle mass? How do we maintain muscle mass? So this is one of the things that we're going to be addressing. We also get a lot of questions with respect to how do I make sure that I stay on a balanced nutrition, that I'm getting enough protein. So Melissa is going to be addressing this as well. And then some of the other things, we're going to provide a broader context of how these medications can be beneficial for other aspects of our health, including mental health, cardiovascular health, more broadly, certainly metabolic health and inflammation. And then lastly, Melissa and I will be discussing what is the best way to get off of these medications and what are some of the habits that are really important to build in order to reduce the risk of the weight coming back. I really hope you enjoy this conversation, and I hope that it provides important information that you'll be able to discuss with your physician if you're interested in taking these medications or if you're already on them. Hi, everyone. I have the pleasure of having a conversation today with Melissa Reade, our licensed nutritionist and integrative health advisor in our practice. And we're going to talk about GLP-1 agonists. So everything that you wanted to know about these GLP-1 agonist medications for weight loss and diabetes. So these include semaglutide and tirzepatide, also known as Ozempic and Wegovy for semaglutide, and Mounjaro as Zepbound for tirzepatide. We've listened to you. We saw some of the things that you guys wanted us to talk about on your social media posts. So thank you for that. And now we're going to dive right in.
Yeah, thank you so much for having me. Such an interesting topic. And I was wondering if you could please, set the stage here for those who may not know or may want to know a little bit more definition. Could you help maybe elaborate on the different classifications of some of these medications, what they're specifically used for, and obviously their differences, because there are quite a number out there that I think people would love to hear a little bit more about.
GLP-1 is a gut-derived hormone that's released from cells that line the entire gastrointestinal tract. What happens is, after food intake, these GLP-1s affect our insulin production by the specialized pancreatic cells. They also affect glucagon, which is another hormone that helps to regulate blood glucose. And they also play a role in gastric emptying and sending signals to the brain promoting satiety or promoting fullness. Now, GLP-1 agonist medications have actually been around and FDA approved since 2005. And so we've had experience with them for about 20 years or so, initially mainly in treating diabetes. And then we've had different iterations of these medications. And in the last few years, as everybody knows, we have semaglutide, which is a GLP-1 agonist medication, Ozempic for diabetes management, and Wegovy for weight loss management. We also have tirzepatide, which is a combination of GLP-1 agonist, but also a GIP, which we'll talk about in just a second. And tirzepatide is known as Mounjaro for diabetes management and Zepbound for weight loss. Again, completely the same compound, just different names. In the case of semaglutide, there are slightly different doses when we get to the higher dose levels, depending on whether one is on Ozempic or Wegovy. For tirzepatide, the doses are exactly the same. So what is a GIP, right? The hormone that's in tirzepatide. So this is another hormone. It's an incretin hormone. It stood initially for gastric inhibitory polypeptide. Then the name changed to glucose dependent insulinotropic polypeptide, which it really means that it promotes secretion of insulin from pancreas, again, to help with blood glucose regulation. And that stimulation of it is dependent on the glucose that's available in the system. So what's very interesting too, and worthwhile pointing out, is that the receptors for GLP-1 and for GIP, while these hormones are affecting the pancreas, they're also affecting multiple regions in the central nervous system, meaning the brain. And this is where we're seeing some of the effects that we'll talk about a little bit later when it comes to some of the ruminations around food noise and some of the other signaling and observations that people have made while on these medications. So again, we know that there's this glucose-dependent insulin secretion and glucose regulation component. We know that there's a satiety component that is exerted by these medications, but there is also this component of certain behaviors and mental health as well, which is very interesting and which we'll dive into. Now, maybe just as the next piece, we can kind of set the stage a little bit about, what have the studies shown and what are we seeing in our clinical practice? So we know that with these medications, and the largest study really on semaglutide that initially was published told us that, on average, we see 15% of weight loss in individuals with obesity defined by body mass index over 30. Again, not a perfect metric of identifying that, but the best metric that we had available or that we have available and we use. And we also found that this effect was achieved over 68 weeks. Then tirzepatide came along, and a study showed that this actually had superior effects on average for weight loss. And so we saw about 20% average weight loss after 72 weeks, so just a little bit longer on tirzepatide. And this is really on higher doses of these medications. So again, anyone that's been on these medications know that we start at the lowest dose of both medications, and then we slowly work our way up. And this is dependent, of course, on tolerance, on the results that are desired and achieved, and so forth. So what we are seeing is that on these higher doses, so for semaglutide, that would be 2.4 milligrams weekly dose. That's what achieved that average 15% weight loss. And then for tirzepatide, we're really seeing that at 15 milligrams weekly dose. That's 20% average. What's also really interesting and worthwhile mentioning is that there is heterogeneity, meaning variability in the results that are achieved. And we certainly see this in our clinical practice in terms of some individuals seem to respond very well and they achieve very rapid weight loss again. And that could be when it's too rapid of a weight loss. Again, we can talk about some of the pitfalls there as well. And other individuals are seeing less results and less of that responsiveness as well. What we also notice over time is that some of the effects might wane, right? So what we see is when we adjust the dose, usually that's when we see the greatest effects of the medication and also potentially some side effects, which we'll address. But after a period of time on that dose, whether that's the maximum dose or the maximum that patient is on, we generally see that the effects start to wane. So let's talk a little bit about, beyond these effects that we're seeing, of course, when it comes to diabetes control. And we really do see this in our practice. Again, people's hemoglobin A1C is better controlled when they're coming in with an elevated level, whether it's diabetes or prediabetes. And we're also seeing improved insulin sensitivity a lot of the time. And again, a lot of these effects are coming hand in hand with that weight loss. We know that there are a number of beneficial effects when it comes to just overall metabolic health and cardiovascular health, which is, of course, closely tied with metabolic health. So let's talk a little bit about some of those benefits. I know a lot of people were interested on social media in terms of, what are some of the additional benefits of these medications in addition to weight loss? So one of the things that we're seeing in our practice, and again, this has certainly been published on, is that there seem to be some emerging anti-inflammatory effects of these medications. Now, a lot of the times what we see in our practice, if there is metabolic dysfunction, And this can be characterized by diabetes, insulin resistance, prediabetes, elevated triglycerides, obesity, overweight, and so forth. If there's metabolic dysfunctions, it's not uncommon to see that markers of inflammation are elevated. And one of those markers that we often check in our practice is called high sensitivity CRP. And the CRP stands for C-reactive protein. And so what this tells us is that there are elevated levels of inflammation in the body. Now, there can be some transient acute reasons for this to be elevated, such as in cases of certain infections and other inflammatory conditions or autoimmune conditions. But when we're talking about CRP elevation in the context of metabolic health, we really see that this marker can be elevated for prolonged periods of time in people and really more related to weight and this metabolic dysfunction. So what's really interesting with these medications, we've observed that over time, and often correlated with weight loss, we're also seeing this reduction in the CRP. Why is this important? Why does this matter? Why are we tracking this thing? Because CRP, or C-reactive protein, is a marker of cardiovascular risk as well. So this is something that we take into account when we look at a lipid profile of an individual and when we are risk stratifying them. And we're trying to assess how great of a risk do they have when it comes to atherosclerosis or plaque formation or inflammation of the lining of their blood vessels. So the fact that this CRP, that C-reactive protein, can come down with these medications is actually a pretty significant benefit. And again, as far as the mechanism of why that happens, I suspect a lot of this has to do with the weight loss. Also, the reduction could be tied to visceral fat reduction as well. There's a kind of visceral fat that's wrapped around our organs that is hormonally and metabolically active. And so as we reduce that, we generally see improved insulin sensitivity and so forth. So these medications are able to help us lose fat. They can also help us lose the visceral fat and improve this profile. Also, improved glucose control, that certainly has an effect on CRP, and potentially maybe some other effects as well. But again, this is a huge benefit that I really want to emphasize in people that are coming in with those elevated CRPs and we're able to get them down. This is a significant benefit. We also see that there are a number of beneficial effects in individuals, again, with metabolic dysfunction when it comes to liver, kidney health, and then some additional cardiovascular health benefit. And how does this translate? So there have been meta-analysis of clinical trials that are really focused on the cardiovascular safety and efficacy when it comes to these GLP-1 agonists. And some of the really interesting and important findings are that there is a significant reduction in major adverse cardiovascular events. And what does this mean? What are major adverse cardiovascular events? This is a composite of cardiovascular death, non-fatal myocardial infarction or non-fatal heart attack, essentially, and non-fatal stroke. So all of these things can be decreased, again, when used in the appropriate setting when these GLP-1s are used. Similarly, hospitalization for heart failure and progression of chronic kidney disease have been reduced as a result of use of these medications. And then again, just want to emphasize, we're talking about, using them in appropriate populations, right? So not suggesting that everybody should be on this to reduce these risks, but again, for appropriate populations where they have been FDA approved for this. Some of the other things that, are very worthwhile mentioning, and Melissa, I'd love for you to weigh in on this and kind of your experience in working with our patients in the capacity of a health coach and a nutritionist, is reduction in food noise. So one of the things that I hear from people, no matter how much weight they've lost, no matter kind of what the other benefits or side effects might be for them, but across the board, I'm hearing from people, and I started hearing this very early on, is this reduction in food noise, right? And so much of the time when patients come to our practice, they, express this real challenge in terms of in their relationship with food, kind of historically how they view food, this rumination when it comes to, can I have this? Should I not have it? Is it bad for me? Is it good for me? Do I allow myself? A lot of thinking about food, a lot of kind of second guessing and kind of struggling really to strike a balance between supporting themselves nutritionally, but also really kind of striking that balance between hunger and satiety. And there's a great deal of rumination and food noise that is virtually gone with these medications. I would say that's probably one of the most kind of astounding, profound things that I've seen. So I'd love to kind of hear a little bit more about your experience with that.
It was kind of a surprising finding. And, like you said, a lot of patients are experiencing far less, mind chatter when it comes to food, and they're experiencing a lot less cravings. And we're seeing just, this really great overall shift in their relationship with food. And this effect, it can be incredibly transformative. And it kind of just reduces the stress around food intake for a lot of patients who are coming in on these medications. It's a surprising finding for them as well. And it's not just with regular food cravings, but we've actually seen this in some studies. I think you'll get into this in a little bit as well. With alcohol as well, there's just significantly reduced cravings for a lot of these types of nutrients and additional, things, additional substances rather. And I think it can kind of be a little bit interesting, right, in the space of nutrition, because on one thing you do want to prioritize nutrient density and food for people, but you're also kind of being able to let individuals breathe and have a better sense of control, a lot less rumination, a lot less anxiety around food choices, and it's incredibly powerful. Yeah, I know that there's a study around alcohol consumption that you'd want to get into a little bit as well.
Yes, definitely. This is another finding that, again, has some similarities, again, to that rumination, to that impulsive behavior. And so this is a relationship that's been studied, the influence of GLP-1 agonists on alcohol consumption. There are some findings showing that there is a reduction in binge drinking and alcohol cravings and desire to drink among users. And, we're still kind of exploring what are the exact mechanisms that are causing this, and how are GLP-1s impacting the brain's reward pathways. There's some evidence when it comes to brain imaging, but then also in terms of the habits in people with alcohol use disorder. And, one of the interesting studies that was done is in a sample of just a little over 1,500 patients or participants. And it was actually a social media study. So, of course, there are going to be certain flaws associated with this. But on the other hand, there's a real world component to this in terms of what are people saying, users of these medications, what are they experiencing and reporting when it comes to that. And this particular study found that 71% of the individuals identified that they had craving reduction, desire to drink decreased, and they're also noting that there was a significantly lower self-reported intake of alcohol, so reduced desire, but also actually lower intake, and then reduction of actual number of drinks per drinking episode, and reduction in binge drinking odds. So again, some really interesting benefits when it comes to semaglutide and tirzepatide medications that definitely warrant further exploration. The other piece, too, that we hear from patients is that oftentimes there is this kind of either reduction in anxiety or improvement in overall health and well-being, improvement in energy levels. And again, I think this really warrants further exploration and understanding how do these medications cause these effects and why. But this is another piece that certainly has been reported in the literature and that we're seeing as well.
Yeah, absolutely. It'd be great to see some additional studies on just food-related behaviors and, as you were saying, just increases in energy and mood, it sounds like, as well. But we're seeing that a lot.
And now I think we should address one of the things that people have asked us about the most, which is one of the side effects that's been reported with these medications, and something that is real and prevalent. But the first side effect that I'll mention is the one that people are asking us about is, what happens to muscle loss and how do I mitigate this muscle loss, right? So, one of the things that has been reported is that when people lose weight, there can be a significant loss of lean muscle mass. Now, lean muscle mass is very important to metabolic health long term. It's important to bone health. It's especially important for individuals who may be at an increased risk of bone loss. So postmenopausal women, people that are of an older age in general. And the reason that we're concerned about that is because there's this amount of weight loss, and a significant amount can be coming from muscle. So lean muscle mass loss has been reported to be between a third to 60% of the weight loss. So again, just like with the amount of overall weight loss that we're seeing reported, we're also seeing a great deal of heterogeneity in how much of that total weight loss is actually coming from muscle. And other studies report as little as 15% or less of total weight loss coming from muscle. One of the things that we do in our practice is we encourage our patients to periodically assess their body composition. And really the gold standard way of doing that is by doing a DEXA scan. So this is something that in an ideal world, we would like to collect more data on so that we have better information about, who are the people that are at a higher risk of muscle mass loss, and, how do we track this better so that we can prevent it. But in general, when it comes to DEXA scans, and this is again in individuals that are looking to that are looking to lose weight that may not be on these medications, or people especially that are on these medications, it may not be a good idea to talk to your doctor about doing a body composition scan and a DEXA scan, and periodically checking that to assess that loss. So this is something that, again, Melissa, you and Erica as well are registered dietitian and integrative health advisor in our practice. I know you guys talk about this with patients all the time and really emphasize these good habits that on the one hand are going to support them and reduce the risk of weight coming back after they get off of these medications, if they get off of the medications. And the second piece is, how do we preserve that lean muscle mass? So I'll let you kind of talk about some of the very concrete, specific ways in which we can do that.
Yeah, absolutely. It is definitely the number one question on people's brains, right? Because I think whether or not you choose to take one of these medications, a lot of people want to figure out how to, safely get off of them one day. And we know that how people behave with food and exercise is going to really dictate their outcomes and their responses. So definitely when we're seeing individuals on GLP-1s, their caloric intake is really going to be significantly reduced. And that's where a lot of the benefit is coming from these, sustained hypocaloric diets. But at the same time, and especially with the reduction in food noise, we see patients who aren't always prioritizing these really nutrient-dense foods right away. And for a lot of individuals, that means that protein is really going to be, or protein intake rather, is really going to be compromised. When you're not hungry, and when you have that appetite suppression, no one really is desiring to reach for like a big piece of chicken or something that can be really satiating or uncomfortable. So what I try to encourage patients to do is focus and prioritize their meals on getting sustained protein throughout the day, throughout all meals. And for some individuals, this might look like 4 or 5 smaller meals throughout the day to support their reduced appetite, where we're getting anywhere, between 1 to 1.2 grams of protein per, pound of body weight. And so for a lot of people, that can be a lot of protein. So the first recommendation I really have is, meet with someone who can support you in identifying what your own personalized nutritional needs are and your own protein needs are going to be, so that you can see how much you would take throughout the day, right? Maybe it's 30 to 35 grams, breakfast, lunch, dinner. Maybe it's an additional 15 or 20 for a snack. And then we need to hone in on what are those easy digestible sources of protein, right? What are the things that we can rely on and grab throughout the day that are going to give us that quick protein fix. And we know that when we are supplementing with protein, it's going to preserve muscle mass. This is the number one way in which we can really prevent catabolizing lean muscle tissue. And when we're preventing this from happening, we're ensuring that your basal metabolic rate is staying at a pretty elevated level, so that we're not dipping down into a place where you're having decreased energy exertion. So one of the best things that I like individuals to reach for, if they haven't already done so, is finding a really good protein replacement shake. This is actually really common for individuals who start GLP-1 medications who aren't used to having a lot of high volume food, or really typically feel unwell when they're having high volume of food. So whether it's a protein powder, or if it's, something like Greek yogurt, a protein bar, something that is going to be reliable and consistent is really important to take stock of. And then we'll dive in a little bit deeper here with the specifics, but this is really individually based. I would say that my patients who are meat eaters and do eat animal protein do a little bit better when they're on GLP-1s, because we know that you're able to reap a lot more of those free amino acids from animal proteins versus plant-based sources of protein. So that's something to definitely consider if you are someone who has specific dietary preferences. In addition, though, to the protein, emphasizing protein intake, the second thing that we want to establish really positive habits around is resistance training, exercising. While walking is fantastic and swimming is fantastic, we really want to make sure that your muscles are being activated and they are being challenged. For most people engaging in any kind of physical activity, we want to make sure that it's something that you actually enjoy doing, and that you can do at least 2 times per week. But of course, this is going to really depend on where your baseline is. So, I would say that individuals who are just starting out in the gym or really haven't worked out, consistently, don't have a really good routine, starting 2 days per week with some sort of resistance training where you are putting those muscles under tension and stress, which means weightlifting, right? Dumbbells, it could be assisted with resistance bands or any machine or cable machine to support stabilization of the muscles is going to be really important. And I would suggest, minimum of 30 minutes 2 times per week, where you are doing anywhere from 12 to 15 reps, almost to failure, where you're almost really struggling to get that contraction of that muscle, because we know that when the muscle's under tension, that is where the building of the muscle actually occurs. So, if you're someone who has a little bit more practice in the gym with a specific workout routine, you can definitely increase this to 3 to 4 times per week. But what makes the exercise really beneficial is that you're fueling yourself for your workouts. So this is where that energy piece really comes into play, right? We do want to make sure that you're able to be active and have the motivation and the energy to step into the gym 2-3 times per week. But that what we're seeing is, and at least anecdotally in practice, is that can really only be supported, for 3, 6, 12 plus months if you are getting in the proper types of nutrition, not just from protein, but from micronutrients and other vitamins as well. So, protein intake, number 1. And resistance training, number 2, as those main factors to support prevention of muscle loss. There are some cases where some supplementation of creatine might be helpful and supportive here. There's really no contraindications here unless you are someone with a kidney condition. So you definitely want to make sure that that is something that you and your doctor feel safe with you supplementing. But ultimately, with the right kind of guidance, you should be able to get adequate amounts of protein for your goal weight.
Agreed. Thank you for sharing that. And I know that in working with patients, that definitely employ some of the, food logs and tracking, because it can be really difficult sometimes to estimate, am I getting enough, right? And so the logging and the tracking, even if it's for a very short period of time, I think it really gives people insight into their habits and then in how to modify that. And I agree with you completely, whenever possible, whole food ways to support protein, but I agree that high quality protein shakes can be very, very helpful in that case. And what we often see that can be better tolerated than foods that might be, again, kind of causing more stretching and more satiety signals to be sent back up to the brain. So we definitely want to keep that in mind. One thing that's worthwhile mentioning as well, there is research underway to develop agents that can help with this muscle mass loss. So I wanted to mention one study that was published last year in 2024 that looked at monoclonal antibodies that essentially bind and block the activity of a specific kind of receptor called activin type 2 receptors. And by blocking this receptor, they can actually prevent skeletal muscle mass loss, and they can actually preserve that muscle. And in mouse studies, and again, this was a very short-term study, but they did find that when mice were treated with semaglutide and they were also given this same type of antibody, that they were able to preserve their muscle mass while achieving superior fat loss. So again, there may be some agents that we're seeing down the road that might be able to help us counter this side effect as well. Of course, that is not a way to avoid, promoting these healthy habits. But again, something that's interesting and worthwhile mentioning. We still obviously want to make sure that we're getting enough protein and that we're exercising for all of the other health benefits as well, right? Not just for that muscle mass support. So let's dive into some of the other common side effects. We often hear about, and especially in the beginning, I found that when we were just starting to prescribe these medications, we often hear about some of the kind of more concerning side effects, such as acute pancreatitis, gallbladder issues, and gallstones, concerns certainly of thyroid tumors developing. Now, it is important to mention that there are some contraindications to these medications being used, including individuals with a personal or family history of a specific kind of thyroid cancer called medullary thyroid carcinoma, or people with a personal or family history of something called MEN2 or multiple endocrine neoplasia syndrome type 2. That's essentially a very rare genetic disorder that can cause a number of different types of endocrine cancers. So those two are contraindications for these medications, and people starting on the medications need to be informed that if they do notice a lump in their neck, difficulty swallowing, that obviously any voice hoarseness, any other symptoms that could suggest enlargement of their thyroid gland, to report that to their doctors. But we don't have any guidance or recommendations as far as routine monitoring for thyroid cancers. And so this is something that's considered to be a more rare risk, but certainly something that needs to be kept in mind. And those individuals at high risk, cannot be on these medications. So what about some of the very, very common side effects, right? So gastrointestinal issues. Most people are going to some degree, experience some nausea, maybe a little bit of bloating, abdominal discomfort, or change in bowel habits, which can go both ways. I hear more from patients constipation and slow gastric emptying, or like that sense of satiety or fullness, which is exactly what these medications are doing. They're slowing down gastric emptying, or in some cases, people might actually experience diarrhea. Those are really some of the most common things that I hear about. Typically, people will notice the most prominent side effects when we're changing doses. So when we're up titrating the dose. And again, sometimes we may need to modify that up titration protocol based on the side effects. And then the other time that they might notice these side effects is, let's say, if they're eating very late at night and then going to bed, or maybe they have a higher portion of foods, or maybe they're eating foods that are particularly irritating to them. Maybe it's something very spicy and so on. I don't know if, Melissa, you have any other thoughts of kind of what are the specific foods that you found to kind of exacerbate some of these symptoms?
Yeah, absolutely. We're seeing definitely spicy foods being particularly irritating to an already kind of irritated gut if you're someone who's a little bit more susceptible to those foods. But we also see that we're having a little bit of decreases in dietary fat. So high fat diets are particularly they can put a lot of like stress on your gallbladder and your digestive system. So I find that many of my patients really stop really wanting a lot of these higher fat foods in general. They find themselves kind of removing them anyway. But higher fat foods, acidic foods, and a lot of cruciferous vegetables, like very high fiber diets, because of the level of stretching and potential for gas and fermentation with delayed gastric emptying with these medications. Some patients find that maybe they can't tolerate as large of a raw salad or like beans or legumes as well as they were able to before starting these medications. So it really is individualized, I would say. We have such a range of, personalized responses to these foods. But I would say, being careful and monitoring how much fiber you are getting. Although fiber is incredibly important, we don't want to advise patients not incorporating fiber into their diet. But we definitely want to be mindful of how much, especially with those harder, more like cruciferous raw vegetables at times. So I would say, when in doubt, you probably want to opt for cooking them down a little bit more and spacing them out. So not having all of your fiber worth in one sitting, but really doling it out mindfully throughout the day. Great question.
Agreed. Absolutely. And the other thing that we noticed too is that within the first day or two after the injection, the symptoms might be more severe. So those are usually the days that we might need to pay closer attention to that. And then for a lot of people, those symptoms will wane over time. The other thing that I've noticed when I've converted patients from semaglutide to tirzepatide is that oftentimes, even if their symptoms were mild on the semaglutide, it's interesting when they've been converted to tirzepatide, so either Mounjaro or Zepbound, is that they notice that the symptoms completely went away. So again, this may be due to the ratio and the different amounts of GLP-1 versus the GIP. But I'm noticing that trend of those medications being a little bit better tolerated. And of course, personalizing the dosing, personalizing the titration to maybe prolong that titration of dose escalation is really important to keep in mind as well. But like you said, definitely those slower eating, smaller portions, really tuning into satiety and hunger, being mindful of fiber. Like you said, we never want to discourage people from consuming fiber, but it's important to kind of be mindful of when you might want to just reduce those portions a little bit if it's very, again, irritating and causing discomfort and bloating and so on. And then some of the other things to kind of make a note of for people that are experiencing some nausea, it can be more helpful to do a little bit more bland foods for a period of time. Ginger tea or ginger support or some type of pro-motility support can be helpful to mitigate that. And then for individuals that are having a greater tendency towards diarrhea, identifying those triggers. Are they consuming coffee or alcohol or soft drinks, artificial sweeteners like sugar alcohols? Are there other things that in the diet that might be making those side effects worse? And then for constipation, it's so important to stay on top of the bowel regimen. Now, of course, the bowel movements are not going to be the same as they were before because there's a significantly reduced caloric intake, and then there's also the gastric motility is impaired. But again, it's important to hydrate with water, stay on top of activity. Again, another reason to exercise is to stay on top of that does support the bowel movements, and so to stay on top of that. Again, fiber intake as tolerated. But we also sometimes recommend supplemental fiber. And sometimes when certain fibers like psyllium husk, for example, if they cause a great deal of bloating, we might try something like sun fiber. There are different options in terms of what people might tolerate better. And then, of course, over-the-counter medications or supplements for constipation, such as Miralax or magnesium oxide. There are so many different options here that usually these symptoms should be well managed and definitely discussed with your provider if you're having that. But again, 99% or so of these side effects have been kind of classified as being mild and non-serious in general, according to some of the data that we have. Anything else that one other thing that we did want to mention was the risk of hypoglycemia or low blood glucose. And I generally find that this is more of an issue with people who are on these medications because of diabetes, and then maybe they're on other medications as well, right? Because when we combine different anti-diabetes drugs, we might run a risk of reducing blood sugar more than what's normal. In some cases, we do have people use a continuous glucose monitor, and that can be very helpful in terms of assessing a number of things. But among those, what are the foods that are spiking you? What are the factors, maybe other than food, such as activity levels, stressors, sleep quality, the order in which you're eating food, the quantities, are they spiking blood glucose? But similarly, if a person is experiencing hypoglycemia or low blood glucose levels, again, what are the factors that are causing that? So just something to keep in mind. But I will say I really have not seen this, to the degree that maybe it's kind of been talked about or warned about. And again, part of this is that these medications, the way they act is they're glucose dependent. So if there are low glucose levels in the system, again, we're not necessarily going to see that promoting that extra insulin and so forth. I don't know if you have anything else to add in terms of your observations with supporting patients that are using continuous glucose monitors in this setting.
Some patients kind of already are on a CGM if they are working on, losing weight or getting their A1C under control, of course. But I think it's really important, like you said, to just monitor what those symptoms of hypoglycemia can be, because that can oftentimes look like nausea in the morning or throughout the day. It might also look like some headaches or just unusual amounts of fatigue. So there's a lot of overlap here with some of these symptoms, but I haven't had a lot of patients experience significant hypoglycemia that weren't already aware that this was something that they needed to be, monitoring themselves or aware of. But I also just wanted to say I loved how you mentioned just being mindful of, the meals and pacing beforehand. I think it's so important to work on chewing your food really mindfully and taking a couple of deep breaths just before you are eating so that your body can just start to understand that it's getting ready for food and digestion in general. This also can significantly reduce the amount of air that gets trapped in the intestines and significantly reduce the amount of stretch that we might feel if we're eating quickly or similarly drinking things through straws. So just another kind of practical tip for some patients if we're looking to reduce the amount of fullness, mitigating straw use, carbonated beverages, things that might, pump the stomach with a little bit more air, and really slowing down at meal times.
I agree with you. And I think that's just generally great advice anyway. We talk to people about mindful eating, whether they're coming to us with irritable bowel syndrome or they're, on GLP-1 agonist medication or looking to lose weight in other ways. It's such an important practice, and it can sometimes be very difficult in today's world where we're multitasking. And I know I'm guilty of this many times as well, where We feel like, oh, while I'm eating my lunch, I can also, do some work, and attention is all over the place, but really tuning into our bodies. And I was doing an Instagram live yesterday, talking about the gut-brain connection. And one of the things that's always striking to me when this is discussed is that the vagus nerve, which is the biggest nerve of our parasympathetic nervous system, that connects our brain to our internal organs. What's interesting is that 90% of the vagus nerve fibers are traveling from gut to the brain, and only 10% from brain to gut. And it really tells us how evolutionarily the prioritization of those internal signals is made very clear by the fact that 90% of fibers are carrying that information from gut to brain. And so really taking that literally and thinking about, okay, when I have my next meal, how can I be more in the present moment? How can I be tuning into what I'm feeling in my body? How can I pay attention to chew more and to really just be fully immersed in the experience of tasting and enjoying my food and all of these things? There's a wonderful mindfulness exercise with a raisin. It's usually done in mindfulness-based stress reduction classes with a raisin, where you really take your time to feel the raisin, to hear the raisin, to touch the raisin to your lip, to before you even ingest it. And I remember the very first time I did this exercise a number of years ago. I don't even like raisins, by the way, but when I did this exercise, oh my God, the explosive and very just vibrant and rich taste of this raisin is it was really an eye-opening experience. So anyways, just something to emphasize really for anybody. It's such a helpful practice. So before we wrap up, just one more thing that people have been asking about, and a lot of people in our practice ask about this, and we've heard this from social media as well. What do I do when I want to get off of a GLP-1 agonist? Am I going to gain the weight back? How do I prevent it from coming back? So, we know that effects may wane over time, right? If somebody has been on that dose of 15 milligrams a week of Mounjaro or Zepbound for a long period of time, they may notice that their satiety is not quite as well regulated anymore. They might be able to have an increased, caloric intake. We know that when people stop these medications, statistically, 2/3 of the weight comes back after that first year. In one of the studies that was done on semaglutide, it was about 2/3 of the people. And that can be, again, very variable in terms of how much weight is gained. We really want to emphasize habits here. And I'd love for you to kind of share with us some takeaway messages in terms of those habits that are so important to build while we're on these medications, and then that should really persist when we stop the medication.
So important, right? I think there's obviously a lot of debate going on now whether or not, it's safe to be on these long term, and obviously there are other benefits, but ultimately people do decide to stop because they've either reached their goal, or they feel like, they aren't seeing the return effects anymore. And that definitely speaks to building strong habits while on these medications, as opposed to having the habits be an afterthought. So, again, we discussed earlier prioritizing nutrition and healthy habits around eating, where protein becomes really important. Protein is important regardless if you are on a medication or not, because of that lean muscle tissue. And we know that ideally, the more lean muscle mass you do have, the less weight gain people are likely to see when they are coming off of these medications, because of the sustained effect of their basal metabolic rate. So, it's really important to, if you feel like you have a great handle on nutrition, that is wonderful, but really assessing for yourself, do I have good habits, or is there maybe some room for improvement? Would I benefit from seeing, a qualified nutritionist who can help navigate some of my own personal preferences and really just set the stage for success after I stop the medication. And then of course, we can't talk about protein intake again without exercise and resistance training. So whether you are cycling or swimming or weight training or walking, getting your body moving, getting your body active, ensuring that you are putting it under some degree of stress where muscle synthesis is going to be top of mind, will be important to implement before coming off of it, not just after, right? We really want these habits to be really well ingrained and part of your lifestyle when you're coming off of the medications. And I would say, again, just assessing your own personal need, whether it's looking for a personal trainer to keep you accountable, keep you motivated, finding a buddy who you can find support with. Maybe you have a daily phone call with them on your walk, or just someone to make sure that you're showing up for yourself, right? I think these are really important lifelong habits everyone should be, implementing, but most definitely if we don't want to see a lot of that weight gain come back. And then kind of the last thing I'd say is some people do see that return with that food noise and some food cravings. So if you are someone who feels like this is a significant, issue for you, it's important to seek professional help, right? I think this is there's obviously a lot of ultra processed food out there and hyper palatable food that we all come into contact with, and that there's no denying that everyone can often fall victim to how delectable and tasty these foods are. But if you are someone who is really feeling like your relationship with food is one of the primary reasons for maybe taking these medications at first, definitely assess your own risks, but your own need to talk about this in a space where you feel supported and you can get some informed guidance.
Definitely. Yes. Thank you, Melissa. And one thing is you were talking about, emphasizing the importance of keeping up with exercise and making sure it's not an afterthought and really building those habits. One of the things just to share in terms of, the potential effects, that there's a significantly lower intake of caloric intake while on the medications. This could potentially lead to certain vitamin or mineral deficiencies, so iron, vitamin B12. So it's very important. And again, when those are low, people may not have the energy levels for exercise and whatnot. So it's just really important to rule that out and make sure that this is something that is not a factor in that, and it's not hindering the ability to engage in activity. And the other piece too, like you said, finding a buddy or help with accountability. We know from studies that habit change is more effective if we are doing it with somebody, whether it's our loved one, the person that we live with, a good friend. So this is what really helps to reinforce those habit changes. And as you said earlier on in our discussion, doing activity that you enjoy. So again, it has to be co-created by you. And I know this is what you do in your visits too with our patients. You're not kind of just sharing a prescription of, okay, this is what you need to do. It's like, okay, let's co-create based on what can provide benefit, but also what does that person really enjoy doing? What is their passion? What are the things that might kind of be fun or new or different or something that they know, okay, this is, what I'm really into. So again, that's very important for those longer lasting results. Thank you so much, Melissa. This was a really, I think, hopefully helpful overview for people. And again, we welcome any questions that you have, and we will do our best to address them. All information in this video, including but not limited to the video itself, the audio, text, graphics, images, and other material contained in this video, is strictly for informational purposes only. The content is not intended to serve as or be a substitute for professional medical, pediatric, or psychiatric advice, nor is it designed to suggest any specific diagnoses or treatment. Please always seek medical advice from your physician or qualified healthcare provider regarding any medical conditions, questions, or treatment, particularly before making any changes to your healthcare regimen, medications, or lifestyle habits. Never disregard professional medical advice or delay seeking help from a healthcare provider due to something you have heard, seen, or read in this video or audio. Reliance on any information in this video or audio specifically applied to your own case is solely at your own risk.